like we are live. Awesome.
Okay, good.
Right. So good morning, everyone. Welcome to our Hypertension and Kidney Health Live Q&A. I'm Pranam Shetty, the founder and CEO of Evolve Medical Systems, the company behind the app SmartBP and Glucobite. And today I have the esteemed privilege to introduce and converse with Dr. Anup Kumar Shetty, an accomplished nephrologist, a certified physician executive, and an inspiring cancer survivor. Dr. Shetty has dedicated his life to serving patients and sharing his profound knowledge honed at prestigious institutions like the Kasturba Medical College and the University of Toronto. And through his tenure as the former president of the Texas Indo-American Physicians Society. His exemplary contributions to the field of medicine have earned him prestigious recognitions like the TIPS Physician of the Year Award in 2018 and the Greater Dallas Asian American Chamber of Commerce Award in Medicine and Science in 2014. Beyond his clinical practice as an author and a devoted yoga practitioner, Dr. Shetty empowers people to seek and find their infinity in every situation. His best-selling book, The Power of Infinity, is a testament of this philosophy. Dr. Shetty, thank you so much for carving up some time this weekend to discuss this important topic.
Thank you, Pranam. Thanks for inviting me, and thank you for that generous introduction. I'm happy to be here. Thank you.
Awesome. So before we begin our discussion, it's important to note that any information provided in this conversation is intended for informational purposes only, and is not meant to replace the advice of your physician. It's designed to help you have a more meaningful dialogue with your healthcare provider. All right, so let's jump in. So Dr. Shetty, to begin with, could you enlighten our viewers on the vital role of that kidneys play in our body and why they're so essential for our health?
Thank you, Pranam. I will be rational and I'll be a little bit biased towards the kidneys because I care for kidneys and I've spent my life taking care of kidney patients. But leaving that bias aside, kidneys are very vital organs to our body. Just to give you an idea, kidney gets 20% of the blood in the body at any given time. So in other words, kidney gets most blood among all the organs in the body. So anything good in the body is going to touch the kidney more. Anything bad you consume also is going to touch your kidneys more. So, and for that reason, anything we do, anything we don't do is going to impact your kidneys more than likely. But kidneys don't work like in silos. They work with other organs, especially the heart. So kidneys are very important organs for your heart health as well. If we can see the screen, it kind of tells you the links that kidneys have with the other organs in the body. If you go from top at 1 o'clock position in this picture, kidneys are very vital organs for bone and bone health. Kidneys actually activate vitamin D, which are very important for bones as well as other cells in the body. If you move a little bit to your right, kidneys actually make a hormone called erythropoietin, which is the signal to produce red blood cells in the bone marrow. So if you don't have good kidneys, bone marrow is not going to make blood and you're going to become anemic. And if you come down further, the function that most of us are aware of is kidneys are your cleaning stations. So they excrete all the waste products and they kind of work like an overflow unit in that if you consume anything more than you need, kidneys will dump it out in the urine. But more importantly, if you consume less, kidneys are going to preserve them. So, for example, if you drink less water than you should, kidneys are going to absorb all the water, and you will know that you will make less urine. And if you drink more than what you need, you will make more urine. But it's not just about water. Kidneys regulate potassium, sodium, calcium, magnesium, a lot of mineral balance. Now coming down, pH. pH is pH is a chemical term, but it refers to, if your body is acidic or alkaline. So kidney maintains that pH of the body, which is important for functioning of every cell in the body. And then lastly, the blood pressure regulation. And this is the most important part for today's discussion. Kidneys are very vital organs for blood pressure management, blood pressure control. And for that reason, I end up managing, difficult high blood pressures. And just to give you an idea, almost everybody with kidney problem have high blood pressure. Whether the kidney problem is secondary to hypertension or not, every patient with kidney disease practically has high blood pressure. So kidneys kind of touch every organ in the body. That is how important it is.
So that's interesting. You mentioned about high blood pressure, and that's the big topic for today, right? And that's a great segue to the next question. Moving on to the subject of blood pressure, could you elaborate on how variations in blood pressure levels impact our kidney function?
Sure. So kidneys and high blood pressure, the relationship between these is bidirectional. In other words, if kidneys are bad, the blood pressure will go up. If the blood pressure is high for any reason, that will impact kidney function as well. Main reason is the blood pressure is basically pressure with which every organ gets perfused with blood. And most part of kidney is, I tell my trainees, kidneys are a bunch of blood vessels. Like if you dissect kidneys, most of it is all blood vessels. So since high blood pressure impacts blood vessels, it is obviously going to impact the kidney function. So high blood pressure, in fact, is the second leading cause of kidney failure all over the world. So that is how important blood pressure is to the kidneys.
Yeah, like you mentioned, like about 20%, it's saying so much blood, and so if the pressure of that blood going into the kidney is so high, and on a daily basis, right? You also mentioned about sodium, potassium levels that also could be causing some. So it's interesting. On one hand, it's actually affecting the kidneys itself because of the pressure from the tube. Like I'm an engineer, I'm thinking like there's something with a high pressure coming to something, and it's like pushing on it all the time, and over time it's going to wear out or something is going to happen. On the other end of it, there's also these factors like these fluid balances that is also causing, it's like a vicious cycle almost.
Correct.
Yeah. So a question for you, Dr. Shetty, in patients diagnosed with chronic kidney disease, as we discussed today, managing blood pressure is crucial, right? So could you share some common practices for blood pressure management in chronic kidney patients, chronic kidney disease patients, CKD, focusing on both clinical and holistic approaches?
Sure. So if you step back, almost every illness that we suffer or not suffer can be connected to lifestyle. So healthy lifestyle is very important for overall health, including kidney health. So if somebody's blood pressure is high, first thing we address is lifestyle. Now, depending upon how high the blood pressure is, the timeline at which we can wait for lifestyle to impact blood pressure varies. In other words, if the blood pressure is very high, it's a more urgent situation. We cannot rely just on lifestyle changes in those situations. So you would simultaneously implement lifestyle changes and some medicines. On the other hand, if the blood pressure is a little bit high, patient doesn't have any blood pressure related organ damage at that time, where we have time to wait for the lifestyle changes to impact, then we and kind of recommend lifestyle changes, wait for a few months, see how it works, and then depending upon whether it works or not, we decide about adding medicine. Now, on the other hand, if the person already has kidney disease and high blood pressure is secondary to kidney disease, then they need treatment right away. Along with, again, lifestyle changes are important no matter what you do, no matter what medications you choose. So kidney related high blood pressure, lot of times is related to salt intake or sodium intake and retention of sodium in the body. And for that reason, salt restriction is very important part of the lifestyle change that you implement in a person with kidney disease. Just to give you an example, the basic requirement of sodium is around 600 to 700 milligrams, which is a little bit less than a gram. And but during the evolution of human beings, the sodium intake has gone up over time. And now average American consumes around 3,500 milligrams. That is 3.5 grams of sodium per day. And we generally recommend people to go down to 2 grams sodium per day. So know that everything we eat has some sodium. So we generally recommend that recommend people not to add salt, not to keep salt shaker in your table. You know, we need some salt to make food tasty. Now, other way of limiting salt is avoiding fast foods, avoiding eating out as much as you can, because generally restaurant food, fast foods are very high in salt, especially the French fries of the world, the burgers, even the fake meat, the vegetarian meat. They all have a lot of salt. So I would recommend that you avoid that. Now, coming to medicines, there are different class of medicines. There are medicines that are kidney friendly, and then there are medicines which are kidney neutral. So there are few medicines like angiotensin II converting enzyme inhibitors. We call them ACE inhibitors. They all end with the pril, like lisinopril, enalapril, ramipril. Those are kidney-friendly medicines. Then there is another class which is very related to ACE inhibitors. It's called angiotensin II receptor blockers. We call them ARBs as an acronym. And they all end with sartan, like losartan, telmisartan, valsartan. And they all have the benefits that ACE inhibitors have, but they tend to make you cough a little bit less. So generally, I prefer ARBs over ACE inhibitors for that reason. So these are very kidney-friendly medicines. In other words, they increase the longevity of the kidneys. There are some new class of medicines which are good for the kidneys. One of them is Finrenone. Finrenone comes under the category of mineralocorticoid receptor antagonist. There are long names, but remember Finrenone. It comes with the brand name of Carindia. You probably are seeing advertisements on TV. It's a new kid on the block with less side effects and some kidney protection. Now, in addition to this, there are many kidney neutral organs. I say kidney neutral neutral drugs. These are pure blood pressure medicines which do not necessarily have a direct kidney benefit. They all have indirect kidney benefit by reducing the blood pressure, but they don't specifically do anything inside the kidneys. So those are calcium channel blockers, beta blockers, centrally acting drugs, vasodilators, and few others. And sometimes we choose the drug depending upon what else they have. For example, if they've had heart attack or if they've had blockage in the heart, then we might choose a beta blocker because they are not only blood pressure medicines, but they also help prevent heart attack. If somebody has prostate enlargement, we use drugs like tamsulosin, doxycycline, which is a direct blood pressure lowering agent, but it also shrinks the prostate. If somebody is migraine, we might choose propranolol, which also is a beta blocker and reduces the blood pressure. So sometimes we choose drugs depending upon what else they have. But these ACE inhibitors, angiotensin II receptor blockers, and now the mineralocorticoid receptor antagonists, they are not only that they are high blood pressure lowering agents, they are also kidney pills because they work directly on the kidneys to increase the longevity of the kidneys. Now, that is in brief about the medications. Lifestyle changes. As I get older and older, I'm more and more convinced that lifestyle changes are very important. Okay, so in lifestyle changes, you want to, if you're overweight, you want to reduce your weight, and there is no shortcut to reducing the weight. We know that it is difficult, and the calorie consumption has to go down, carbohydrate consumption has to go down, and physical activity has to go up. So whenever you want to lose weight, you want to consume less calories. Your intake has to go down. Consumption as an intake of calories has to go down, and you want to burn more calories. And way to burn calories is by doing exercise. Now, exercise alone is not important. I take it back. Exercise alone is not enough if you're trying to lose weight. So you have to address the diet. So there are a bunch of diets, and I read somewhere that every diet works as long as you follow it. So, but the most research is on DASH diet, which is a diet to stop hypertension, and the Mediterranean diet. So these are kind of similar diets in that they're very rich in plant-based food, and Mediterranean diet is also rich in seafood and some olive oil and some oils. But the main component of these two diets is a lot of vegetables, lot of plant
vegetables, yeah, vegetables, yeah.
And physical activity is important. Like I said earlier, you can do whichever way you like. Walking is good, jogging is good, swimming is good, and using a treadmill is good. That every American family has a treadmill that they don't use. So it's good to use something to increase the physical activity. I find walking easier, and personally, I have 2 dogs, so they make me walk an hour every day. So with the exercise and any lifestyle habit, one of the things I kind of insist is don't make it 3 days a week, 4 days a week, make it 7 days a week. Because when you do something every day at the same time in the same environment, over time it becomes a habit, like brushing your teeth. So I feel it's important to do this every day, 7 days a week, same time, for good length of time. By good length of time, I say 40 minutes to 1 hour. 20 minutes is good, but It's not enough.
But 20 minutes, maybe with like if your intensity is high, but if you're not able to because of various, it could be various reasons, right? Maybe it's you're strong enough, but maybe you have a surgery or a joint issue. So maybe then walking makes more sense. You probably will burn the same amount of calories but you just do it for double the time or something. So
Correct. There is a 20-20-20 rule.
Yeah.
That I found out from Robin Sharma, which is 20 minutes of intense exercise, 20 minutes of something mild like yoga, meditation, and 20 minutes of contemplation, like reading or writing journals or something. So
Yeah.
that's a good rule to follow.
That's actually, so that's so important you brought that up, because see, all these lifestyle modifications, we're always like sort of focused on the physical aspects of it, right? It's like, okay, you eat properly, healthy diet, you exercise. I would say most people already know that, right? So it's like, but it's the mental side of it, like you mentioned, like the last 20 minutes, like contemplation, there's, I don't know, like it seems like we maybe are, do you feel like we're not giving it that much importance, the mental side of these things, and just, being mentally fit for these type of.
Correct. The one person we neglect throughout our life is ourselves. And we get busy for different reasons at different phases of life. But the most important person in our life should be ourselves and our personal health. Because when you do that, you can do good for others too. So yoga and meditation kind of helps you kind of reset the button in life and calm down and be happy and be in the self. And yoga and meditation is more than just physical activity. There is mental component to it, and there is it works at your brain level, it works at your adrenal glands level, it works at your thyroid gland level. So there is research to show that these reduce the stress hormone levels in the blood. In fact, there is a study on transcendental meditation that they studied in somewhere around Boston, in actually nursing home residents, and they found that their longevity increased among patients who did transcendental meditation. So there is a lot of value to yoga and meditation. Now, it's hard to do long-term studies on yoga and meditation, because whenever you do this study, you need to have a control arm where you want to kind of mimic it. And it's very manpower intense. So there are no real long-term studies on yoga and meditation, but there are lots of short-term studies on yoga and meditation, which favor doing it.
Yeah, and there's one thing I just feel personally about myself, right? When I'm taking care of myself, there's no cost to it, right? So maybe people are, yes, studies are extremely important, right? But I would say that's important when you're putting something in your body. Like, let's say there's a drug, so you want to make sure it's fully validated, it's gone through all sorts of clinical trials, and then you're like, is it safe and effective to use? Okay, but I think like these things, right, if it works for you, it works for you, right? There's nothing, no harm that can happen from it. So you could just try it out, and if it helps, right? So
exactly. And there are different brands and flavors of yoga and meditation again. And I tell people, just try different ones, and you will find something that you will like. And it's cheap, and try it for 6 months. If you like it, continue it. If you don't like it, or if you don't see the changes, then move on and do something else.
Yeah.
But like you said, it's not like putting a medicine in your body.
Right.
It stands to logic
Yeah.
that one has to do this.
All right. Awesome. So let me check if there's anybody on Facebook who have any questions on this Q&A.
Sure.
Let's see here. Okay, so maybe the questions might start coming in. So while we're waiting for these questions, one question for you. So innovation and medicine often walk hand in hand. Could you shed some light on the latest advancements in hypertension and kidney management that you find particularly promising?
Sure. So the last few years have been very interesting years for us because, if you go back last 20 years or 30 years, not breakthroughs in medicine don't happen every day. Okay, and kidney care is no exception to that. But in the last few years, we have had some interesting innovations which are good for kidney health. And one of them was that mineralocorticoid receptor antagonist, introduction of Finrenone. And that is shown to increase the longevity of the kidneys. The other innovation that we see and apply is a class of medicines treating diabetes, the SGLT inhibitors. Those are like all the fluoxetines. The brand names are Farxiga, Jardiance, Invokana, and in Europe there are a few other products. These were originally introduced to treat diabetes. They make you lose a little bit weight, but what was surprising was they increase the longevity of the kidneys and they help the heart health as well. And initially I was a little bit skeptical, but more and more data is pouring in. So now we are convinced that all the diabetics with kidney disease should be on this class of medicines.
Oh.
So these are the two breakthroughs we have seen in the last 2-3 years. So it's an exciting time to be a nephrologist, where we can make a difference.
Actually, Dr. Shetty, you also, so you mentioned diabetes, and earlier we were talking about, you're also mentioning about the heart. It seems like you are like, there should be like some level of super communication, right? Across like all, like the doctors who are treating for heart disease, the doctor who's treating for diabetes, and you, like that level of communication should be solid, rock solid, to be able to understand what's going on in the patient. How do you go about that? Like, is it like, do you have these summaries on your charts or something like that, and you see, okay, this is what's going on, or there's these discussions that you have with the doctors? How does that?
Yeah, so one thing is patient education is very important, because I tell my patients, one person who doesn't leave you is you. The doctors change, hospitals change, but you go with yourself. Electronic medical records keep changing, but the person who goes with you is you. So I make it a point to give the printout of the labs, and I actually give some handwritten instructions as well to every patient of mine. We also have a very comprehensive kidney education program in our practice for different levels of kidney disease, covering different parts of kidney health. And the electronic medical records have helped in communicating with other care providers. So a lot of times we, they have access to my notes, and I have access to their notes. We also go the old-fashioned way, where we fax the notes to each other. But if there is something important, we pick the phone and talk to the other doctor. Yeah. Because nothing can replace, a personal call.
Yes.
So we do both old-fashioned way and new way.
Do you feel that the call is happening even amongst younger doctors, or it's like more like electronic? Most of it is like mostly electronic, the messaging, or do you feel like that human connection is still prevalent amongst?
I think human connection is still there, but younger generation, of course, is more savvy with technology, and they embrace technology more than older people. But they also have seen only the new way. Those doctors who got into medicine after electronic medical records came in, they have not seen any different way. So they're very savvy, they're very comfortable, using technology,
Yeah.
which is okay, because now we have HIPAA compatible, electronic methods to communicate with other doctors,
Okay.
because we cannot email each other. Emails are not HIPAA compatible, but there are many applications that we use to communicate in a HIPAA compatible manner.
See if we have any other questions here.
Yeah, I have one point that
Oh,
I
sure,
would like
sure.
to
Yeah,
cover.
please share. Yeah.
Again, in lines with the healthy lifestyle, everybody knows about dieting, everybody knows about exercise, and a lot of people know about yoga and meditation. One area that has not received enough attention over time is sleep. Healthy sleep is very important. So generally recommendation is that we need about 7 to 9 hours of sleep. We know from literature that those who sleep less than 6 hours a day, they have more health problems. So good sleep is important, not only the duration of sleep, but also the quality of sleep. Especially that early morning sleep is very important. So if you have to rush in the morning, make time to go to bed a little early, but sleep well, and if needed, catch up during the weekends, but don't accumulate sleepless time over months. You can catch, it's easier to catch up over a week rather than over months or years. So sleep is extremely important. And in the same line, if somebody has sleep apnea, like if you're overweight, if you snore, then it's important get yourself tested for sleep apnea and treat it appropriately. And it's easy to treat sleep apnea, and it impacts your blood pressure, but it also impacts your quality of life. So I wanted to.
Yeah, I'll make a note of that. I'll update our blog here, to add the point about sleep as well. I think that's, and our body needs to recover, right? So all right, awesome. Well, it looks like we don't have any, let me look again here. Okay, so I don't see any more questions. I'm just gonna, yeah, I don't see any questions, but I see a comment. Good, thank you for sharing this. Awesome. All right, so thank you so much, Dr. Shetty, for sharing all your knowledge and experience here and helping our people manage their blood pressure and take better care of their kidneys. Post our enlightening discussion with Dr. Shetty, I encourage all of you to further explore this critical topic. You'll see this, you can find our comprehensive article on our blog, on the SmartPP website blog. It's titled Hypertension and Kidney Health, Understanding the Connection. And you can get further insights on this topic. We'll also be making this video of this Q&A session available on YouTube. So do subscribe for more, and stay updated on more informative discussions in this in the future. Also, remember monitoring your health. Metrics like blood pressure is an integral part of managing your health. Our app Smart BP provides a seamless solution to this need. It effectively replaces traditional methods of logging blood pressure readings in a notebook, which can be tedious, time-consuming, and inefficient. So with Smart BP, managing your blood pressure becomes a more streamlined and effective process to help you discover trends and stay on top of your blood pressure. Please remember that the information provided is intended to support, not replace, the relationship that exists between you and your physician. And it's meant to empower you to have a more meaningful dialogue with your healthcare provider. Please keep that in mind. So your health is your wealth, and understanding your body is the first step towards better health. We are deeply grateful, Dr. Shetty, for taking time to share this invaluable insights with us today. Thank you so much.
Thank you, Pranam. Thank you all for listening. Have a good day.